Hello, and thank you for viewing our legislative update webinar now that the session has officially wrapped up. This webinar is being hosted by the Indiana Coalition for Human Services, Indiana Association of United Ways, and the Children's Coalition of Indiana. And today you'll be hearing from myself, Maggie Snyder, Public Policy Manager for Indiana Association of United Ways, David Sklar, who is the Director of Government Affairs for JCRC, and he also serves on the ICHS board and as our Government Relations Chair, and Mindy Goodpaster, who is the Policy Director with McCoy and also the President of the Children's Coalition. So again, the session just wrapped up on April 21st, and this was a long session where legislators were deciding funding decisions on the budget, the $32 billion biennium budget, and they reached that decision at about midnight on April 21st. The State House right now has supermajorities in both chambers. There was an election last fall, but that didn't really shake up too many of the seats in which party they represent. And you can find out more information about legislators and which district they represent at the website listed on the slide. And now I'll turn it over to David.
Okay, so just like basically every normal session, we go into the State House learning and trying to understand what the priorities are of the governor's office and the various caucuses. Obviously, Governor Holcomb was elected last November and took office in early January. So obviously that's first-time governors come in, with some extra weight on their shoulder because they're basically sort of working from the blueprint of the budget direction from the previous governor and then trying to put their own stamp on their priorities and their budget requests going into their first session. So Governor Holcomb laid out his priorities early in 2017. And you can see them here, cultivating a strong, diverse economy. Infrastructure spending was definitely a top priority of the governor. Wanted to really work on sort of building a 21st century skilled workforce. And a lot of this discussion at the General Assembly this year centered around some workforce development things, as well as, obviously a very large discussion that took place over pre-kindergarten education funding that we're going to talk a little bit more about here. The drug epidemic is definitely at the top of the governor's agenda as well. Moving forward, the caucus priorities, you can see here, Maggie is moving the slide, you can see some of these caucus priorities. Obviously, being a supermajority Republican legislature, we're probably not telling anybody anything they don't know, but obviously the priorities at the end of the session are going to be much more closely aligned with House and Senate Republican caucuses, just because they have the ability to govern basically without Democrats being present. And you can see some of their priorities here. The balanced budget amendment passed this year. I think we're going to talk a little bit more about that, but a constitutional amendment to require a balanced budget passed this year for the second time. So that resolution will be going to the ballot as a referendum for voters to decide on. Infrastructure needs was certainly at the top of not only the governor's priority list, but also the House and Senate Republicans list. Obviously, they are hearing from their local communities about the sort of dire state of road construction and road maintenance in this state, and both those caucuses were committed to a long-term funding structure for those. Opioid abuse. Senate Republicans were focused on replacing the ISTEP program. Both workforce development and opioid abuse and addiction also top priorities. So you can see that the priorities of the House Republican caucuses, Senate Republican caucuses were fairly similar to the governor's priorities for this session. Democrats, obviously, a few different priorities. Education, I think shared the goal on pre-K education, maybe some different ideas on how to get to the end of the day, get there, and funding structure, and maybe looking a little different. Redistricting, definitely a top priority of the Democrats, and clearly you can kind of understand why from a political perspective. But a lot of grassroots support out there in the communities to create a commission to draw some nonpartisan districts. And so there was a lot of discussion about that, a lot of advocacy this session around that issue. LGBT civil rights is still on a top priority of both Democratic caucuses, although that conversation did not necessarily come to fruition this year. It remains a priority of theirs. Working families and low-income families, and also hate crimes is a priority of both the House and Senate Democrats. So we had some. Sorry, I'm jumping in here. There were definitely some hot issues. Mindy's looking at me. I apologize because I stole her slide, but some hot issues for the session this year. So again, a lot of these are very similar to priority issues for all the caucuses: opioid addiction, pre-K education, ISTEP replacement, infrastructure and road funding. Really infrastructure was, I think, the key to the entire session. Figuring out how to fund the infrastructure program was what ultimately allowed Republicans to decide on what could ultimately be in the budget at the end of the day. Some other things that came up, some focus on the SNAP program, both from a perspective of asset limits, making it a little bit easier for people to remain on that program to become economically self-sufficient, also ex-offenders. Hate crimes continue to be a hot topic for about half the session. Firearms, definitely a hot topic. And then some things popped up that really nobody knew were coming, including some alcohol licensing issues, also some gaming tax issues that sort of popped up at the middle to the end of the session.
So we've grouped the legislation according to the ICHS priorities, and so we're going to cover key bills in each of these areas, including Healthy Hoosiers, Working Hoosiers, Workforce-Ready Graduates, Accountability and Outcomes, and Thriving Communities. With regard to Healthy Hoosiers, a lot of bills passed, and just some key ones to be aware of. House Bill 1337, telemedicine. We continue to look at how we improve our telemedicine regulations and policies, and how we also include behavioral health into that mix. There was a lot of concern about, how do you handle a first-time patient through telemedicine? Do you require a face-to-face visit? Is there a wellness check that has to happen? And how do you do all of that? So 1337 looks to sort of clarify and address some of those issues. Another one to note is 1278, cervical cancer prevention. This was a bill that crashed and burned last year, unfortunately, but this year it was resurrected and survived. And so what we're going to be doing is forming a task force and looking at how we do a better job of creating more awareness about cervical cancer prevention and getting more awareness out through pediatricians and other physicians to create more interest in the HPV vaccine and things like that, because we're definitely not seeing the rates of vaccinations that we should be in our young people. And then finally, because of the interest in the opioid epidemic, House Bill 1438 had to do with the syringe exchange programs and really looking at how we can maximize the expansion of that to communities that are suffering or on the verge of suffering from this epidemic. So we've removed the restrictions in terms of limiting, applying for a syringe exchange program once you've determined you have an emergency. Now communities don't have to do that. They can determine for themselves whether or not they feel they need it and probably try to get ahead of the curve a little bit. And then the approvals would be good for about 2 years, but then they could renew if they still felt they needed the syringe exchange program. With regard to mental health, we had several great things happen. One of the biggest is license reciprocity for behavioral health professionals. There were two bills that passed, Senate Bill 59 and House Bill 1391, and essentially we're doing a couple of different things. One, we're addressing the reciprocity when a mental health professional such as a social worker, psychologist, mental health counselor, marriage and family therapist, when they move here from out of state and they're already licensed and they've got some experience under their belts, they can move here and be granted licensure if they meet certain qualifications, including they cannot have any outstanding disciplinary actions on their licensure in the other state. So this is tremendous because we've had a lot of people be denied licensure here in Indiana for various reasons that were sort of inconsequential. So we've tried to ease those restrictions to make it possible to improve and grow our workforce for when people move here from out of state. We've also created a bachelor's level social work licensure so that graduates with a bachelor's in social work can get licensed to practice here in Indiana. And we've also created an associate level license for addictions counselors. We've also done a lot of different things with regard to opioid treatment and substance abuse treatment. And one of the biggest things is we are going to have a newly reformed commission to combat drug abuse, and a lot of these programs and a lot of these initiatives and even some funding are going to go to this commission, and we'll talk about that when we get to the budget. But there's going to be increased attention paid to treatment services, to limiting prescriptions, and things like that with regard to opioids. We also had a big bill come out, 1430, Suicide Awareness and Prevention, that I was instrumental in working on. And this does a couple of different things. One, it addresses prevention training in schools for teachers and other school personnel, and this will be ongoing training required every 3 years. It will do more to create policies and procedures in schools about how to handle if a student is suicidal, and also how to handle if a student or a staff member dies by suicide. It creates a state suicide prevention coordinator through the Division of Mental Health and Addiction. And this person will serve as a hub and a resource to coordinate programming throughout the state and really integrate everyone and all of the individual health efforts that happen regionally, and then apply for grants and other resources that we can bring into the state to improve the work that we do. Colleges and universities will have to do more to promote awareness about the services that they provide for their very vulnerable young people. And we're just hoping that all of this is going to coordinate not just suicide prevention for young people, but also for adults. So this is really tremendous for this state.
So we're going to go ahead and keep moving. And as I move, I just want to mention Maggie typed in the chat box just a quick clarification that those bills that are in gray, with the descriptions in gray, are bills that did not pass or died, and those that are in blue are ones that passed. And so we're kind of focusing on the ones in blue, but if you have any questions about something that maybe didn't pass, please feel free to go ahead and type that in the chat box, and we will do our best to address it. So there were a couple of good bills with regards to seniors and people with disabilities. You can see those highlighted there, Senate Bill 390 and Senate Bill 1102, which will create some take a look at some opportunities for employment and providing services to individuals with disabilities. And I think we're going to go ahead and move forward to Working Hoosiers. A couple bills that we want to highlight here, including a couple of bills that unfortunately did not pass, but ICHS worked very heavily on, and our member organizations this year. The first one I want to highlight is Senate Bill 9, Supplemental Nutrition Assistance Program and Drug Convictions. This bill, should it have passed, would have provided access to the food stamp program or the SNAP program for nonviolent drug felons. It's something that was worked very heavily on by our member organization, Feeding Indiana's Hungry, with support from ICHS, and we think that's just good policy to help those folks come out of DOC, maintain their economic self-sufficiency, and reduce recidivism. So we're going to keep working on that bill. And that bill made it about 3/4 the way through the session, and unfortunately ran out of steam. Senate Bill 154, good bill, very good bill, removal of asset limits for SNAP eligibility. What actually ended up happening was we weren't able to completely remove those asset limits. And for those of you that don't know, the food stamp program and the SNAP program currently has has a limit of assets that you are able to maintain and still continue to have eligibility in the program. We argue that removal of those asset limits helps folks get back on their feet by being able to save a bit and stay on that program just a little bit longer to become more economically self-sufficient. And also, should they have an emergency situation where the breadwinner loses their job for just a period of a few weeks or a couple of months, we don't want them to have to basically spend down all of their assets just to receive some SNAP assistance. So what actually happened with that bill was the asset limit was reduced, which we think, or I'm sorry, it was actually increased, not reduced, but increased to a higher level so that it won't catch up quite as many people. So that's a good thing, and I know some of our member organizations are going to continue to work on that legislation and in future years hopefully remove those entirely. I do want to highlight Senate Bill 245, another bill that did not pass, and this is one that we're actually happy about. ICHS worked very heavily to kill this bill. What it would have done is create new, longer-term predatory lending products where individuals would have been able to take out larger loans for longer periods of time at higher interest. Very, very high interest, something around 300%. So would have been some very predatory products, strongly pushed by these financial services organizations, payday lenders, and folks like that. And we worked real hard to prevent that legislation, and we were able to kill Senate Bill 245 in the first half of the session, and then the payday lenders came back in the second half with a proposed amendment to another bill, and we were able to stop that as well. So pretty proud of our work on that bill. And then finally, I just want to, no, I'm sorry, that was it on that slide.
All right, and now we'll get into some education legislation that was passed this year, and I'll start with our usual disclaimer of we don't get too far into the weeds on the education issues. We try to defer to some of the experts in this space, so we're happy to connect you to some of the answers if we don't know 100% the policies behind this, but I will go ahead and say that House Bill 1004, the pre-K expansion bill, did pass this session, and it's really merging the existing pre-K programs that the state is funding through the On My Way pre-K pilot in the 5 existing counties and the early education matching grants, which go to about 16 providers in the state, and it's expanding their funding so that way they can start pre-K, state-funded pre-K programs in up to 15 additional counties, and some of those funds can go towards capacity building efforts to get other high-quality providers to have more open seats throughout the state. So we're really excited to see that expansion to serve more low-income 4-year-olds across the state. A hot issue this year was around the appointment of the superintendent of public instruction. Right now that's a statewide elected position, and over the last couple of years we've seen the debate around this, and this year it did pass where starting in 2021 this will be an appointed position by the governor. So that will be something new for our state. There were House Bill 1003 is continuing on the ISTEP replacement policy. We still aren't exactly sure what that will shape out to be, what that replacement will be, but last session in 2016 they wanted to put an end to ISTEP, and they're still trying to work through finding that replacement for our state. And again, this isn't our usual priority space, but we're happy to help connect you if you have any questions. Oh, Mindy?
I did want to add, both within some of these bills and in another one that we'll be talking about, which is 447 on another slide. There was a lot of attention paid to background checks and other school safety for screening teachers and other school staff better, and how to handle reporting for, if there's a suspected case of child abuse or child maltreatment by a school staff member. So some of these bills had to deal with those issues as well. On child services issues, there were a couple of bills that passed. SB 49 had to do with a plan for the permanent placement of a child, just ensuring that if parental rights were terminated, that there was a permanency plan in place for that child, and that it was documented with the court. House Bill 1091 amended our current child pornography statute to include not only possession of child pornography as a level 6 felony, but also accessing with the intent to view child pornography, meaning anyone that you perceive that you know or understand to be under the age of 18, if you access that with the intent to view and don't necessarily have to download it, that's a level 6 felony. A big bill that happened was Senate Bill 366, driver's licenses for foster children. This waives the fee that they have to pay and makes it easier for them to obtain their driver's license, which is huge in helping them to gain their autonomy. And then also Senate Bill 497, Medicaid eligibility for former foster children, just clarifying the procedures and helping to make it easier for former foster children up to the age of, I believe, 26 to access Medicaid, which gives them critical access to health services that they will need as they move into independence. Some of the other bills in child services, another big bill that happened was Senate Bill 355, which improved our current statute regarding child abuse and child sexual abuse education and training, so that now all teachers in grades K through 12 will be trained in understanding and recognizing the signs of child abuse. There will also be programming for children that is age appropriate on how to understand and recognize, body safety. 447 is the big bill that had a lot to do with various areas of DCS. One area would be improving the criminal background checks, as I mentioned before, for school staff. And then another one is a child who is born with neonatal abstinence syndrome or who has drugs in their system can now be eligible for a CHINS or a Child in Need of Services designation. House Bill 1218 does quite a few things, but one key thing that I was very interested in seeing was a person, particularly a young person who's been the victim of human trafficking, if they were arrested either as a juvenile or as an adult with charges that stemmed from the fact that they were being trafficked, those charges can either be expunged or vacated from their criminal record. So the most common would be prostitution, some would be theft, and these can be removed from the record so that it's, one, they never should have been arrested and convicted of that in the first place if they were being coerced or forced to commit the crime, and then two, it won't hold them back from obtaining jobs or housing or going through their education. And those are pretty much the biggest ones in that category.
One more that I want to jump in and talk just a little bit about is Senate Bill 404. This was, usually about every session we have one or two abortion-related bills that are passed, and this basically was the abortion issue for this session in 2017. Senate Bill 404, in an attempt to deal with some potential child abuse and sexual trafficking issues, made some challenging changes to the parental judicial bypass system that currently exists in Indiana, where if a woman or a girl, for whatever reason, like to seek an abortion but cannot, for whatever reason, bring that to their parent or guardian's attention, there is currently a procedure for what's called a judicial bypass, where a judge can allow that abortion to take place, and the girl would have a advocate or some somebody with them to work through that process. And so there was a lot of discussion about what was in the best interest of the girl seeking the abortion, and how you weigh that with parental obligations and the right for parents to know what's happening. And ultimately, Senate Bill 404 did make some challenging changes to that judicial bypass system. And I think abortion rights advocates and providers are going to have to sort of work through how those changes are going to affect that system and access to those services. We're going to keep moving on to thriving communities. So we have talked a couple of times about House Bill 1002, or the infrastructure spending. Like I previously said, this really was probably one of the biggest issues for the session, and a key to a lot of our other funding questions and the budget for the session. So we are not experts on exactly what is in this transportation infrastructure funding package, but basically what we are looking at is close to $1 billion to be spent over the next 10 years or so. A large chunk of that money will be paid for by a gas tax increase, which will increase the gas tax 10 cents per gallon. So we have some concern there, just because a gas tax is a fairly regressive tax and is going to impact low-income Hoosiers a lot more than higher-income Hoosiers. But there will be a 10-cent gas increase. There will be some new fees on vehicle registration, including a new $15 fee on all registrations, and I believe, either $150 or $250 fee on hybrids, since they don't use as much gas. And the governor will also have, there was also language in the bill that has authorized the governor to begin discussions with the feds about the creation of new toll roads here in Indiana. So I'm going to kind of skip through a couple of those, but want to land on Senate Bill 558. This bill had to do with low-income property, affordable housing, and it does a couple of things. It changes some regulations about regulation of property owners, and the other thing that it did that really concerned ICHS, and we spoke out against this bill, was did two things with regards to affordable housing. One, it now will prevent localities from mandating a proportion of low-income housing units. So sometimes, for instance, in Bloomington, any property development that currently happens in Bloomington, the city requires that they set aside a certain percentage for low-income housing, and the General Assembly has now taken away that right for local governments to be able to mandate that proportions of affordable housing. The other thing it does is it changes apartment restrictions and reduces the number of family members that can be present in an apartment based on things like number of rooms and size of the apartment. It basically puts guidelines in place on the number of rooms versus the size of the apartment. And what that does potentially for low-income families is, if there is a limit on occupancy of number of bedrooms, it could force families into larger apartments with higher rents, where space in smaller, cheaper apartments would probably be adequate and no safety concern for those families. So it's basically potentially moving larger families into more expensive housing. We're going to keep moving forward.
So one of our top priorities in the thriving community space is usually around some tax policies, especially with the nonprofit property tax exemption. So each year there seem to be a number of bills around that topic, and we try to do our best to monitor those. This session, there was a recommended study committee around that issue, but some of the other bills that were targeting pilots, payments in lieu of property taxes did not go through. So just as you're seeing those dead on the side, know that this might be an assigned study committee topic this coming fall, summer. I also want to call out House Bill 1471 around the Indiana 211 program. This bill didn't change any of their funding. It's really just switching right now. Their fund is administered under the Indiana Utility Regulatory Commission, and this is going to be moving that fund to instead go under the Indiana Housing and Community Development Authority, who also administers some of our other human services programs like the Energy Assistance Program and the IDA program. So it's kind of just a smoother partnership for them to be housed there.
And I see that there's a question about money for East Chicago lead cleanup. My understanding is that there is some money that was placed in the budget for that cleanup, and also the governor did extend the disaster declaration for Lake County and East Chicago, I'm almost certain, which will continue to allow some disaster relief funding and state funding for cleanup to continue to flow to East Chicago. So I'm not an expert. My guess is it's probably still not enough, but there are some relief dollars flowing up to East Chicago.
Thank you. Each session there's typically a large number of good government bills. This year redistricting was a hot issue because of in 2016 it was a study committee and it had a number of meetings and a lengthy recommendation submitted to the General Assembly from that study committee. And David kind of touched on that issue before, but I know some of the advocates around redistricting were disappointed this year when it was heard in committee, but was never given a full vote. So that is dead for this year, and we'll continue to monitor that as it continues to pop up.
With regard to some of the other issues that we were watching, some of the handgun legislation that passed, there were a couple of different bills. We had Senate Bill 43, which deals with providing or allowing legislative staff in the State House to bring firearms to the State House to protect themselves. And then we had House Bill 1071, protective orders and temporary gun license. So this allows people who file protective orders with the intention that it is victims of domestic violence who are filing protective orders against their abusers. They can go through an expedited process to obtain a firearm if they do not already have one. They'll go through an expedited criminal background check process, and then they'll basically be allowed to go and get a gun to protect themselves. This is a highly contentious bill. The domestic violence advocates in the community around the state argued strenuously against it because the statistics are not in the favor of victims of domestic violence when there's a firearm in the home. They are more likely to die at the hands of their abuser. And so just a lot of concern about the further danger that this puts them in, especially if they're not given any training in how to use that firearm. And also this bill contains a study committee provision to study constitutional carry, which, and they want to look at other issues related to firearm violence, including homicide and suicide, to really address, should everyone have the right to carry a firearm regardless and not have to apply for licensure or permits or anything like that.
Just a couple other things there. So Sunday sales was not an issue this year. Like I briefly mentioned, what was though was something that popped up sort of midway through the session about who could sell alcohol, who could sell cold alcohol, with Ricker's convenience stores starting to try to sell liquor and cold beer. And basically the legislature closed that loophole. And then gaming, House Bill 1350 deals with some gaming taxes. So Indiana has sort of an outdated gaming tax entrance system where each time you walk into a casino, that casino is taxed $3. So back in the days where we actually had river boats that went out on the water, you were taxed just for that one time while you were on the boat. But now with land-based casinos where people are walking in and out of the casino floor, they are getting taxed each time an individual is walking in and out. And so they, just claim, some fairness issues, and the legislature took a look at that, and obviously that has a big impact on local units who rely very heavily on those gaming taxes for various operations in local cities and towns.
Now we will move on to the budget, and sent out to those that were registered in advance this morning. There was a handout that had this all on one page of a breakdown of some of the key human services items in the budget. So you can see here the final budget outcomes on the right column. So 211 funding was maintained over the last budget. The Family and Children Fund, which is through DCS, and that's what helps them, the funding that helps with their caseload and their services that they're providing, that got a significant increase as they're seeing more and more need for services, and especially in CHIN's cases.
And their administrative fund did as well to hire some of the other professional staff. So both on the service end for the providers as well as for the case managers, they will have more money to hire more staff and improve their services.
There was a cut into the 21st Century Scholar Awards, and I think that's been going on for the last couple of budgets. In 2014, they changed some of the requirements to complete that program, and so they've seen a decrease in participation due to some of those more challenging program guidelines. So that is where that cut is coming from there. You can see that funding for the food banks has been maintained. And now we'll move on. Oh.
And the Guardian Ad Litem and CASA budget has been increased, and this has been a need consistently over the past few years. As CHIN's case is increased, we also need more CASAs and Guardian Ad Litems to help advocate for the best interests of the kids.
So here's where you can see the pre-K funding. You may have noticed on the previous slide that the early education matching grant line item was zeroed out, but that is only because it has been combined with the pre-K pilot line. So that is still there, and those providers are still going to be funded.
We have a new budget line item, the Housing First program, which allocates $1 million to help with finding and securing housing for recovering addicts. This is a new initiative, and that's going to fall under the Commission to Combat Drug Abuse. And the Commission also, it might have been on the previous slide, has been allocated $5 million to dispense as grants to different services and service providers as well. The Nurse Family Partnership is a new budget line item for $5 million, and this is an evidence-based program that's going to help with some early intervention and prevention work around the state.
And then support for veterans. There was a new line item in the budget too for some organizations that provide direct services to veterans in the state. So that was increased funding there.
And also the Family and Children Fund might have been on the previous slide, but the Family and Children Fund, which serves child welfare agencies and services, received a pretty nice increase this year.
So if you have any questions about the budget, feel free to type them in. We'll keep moving along.
So study committee topics, this is something that we talk a lot about if you've been either at previous ICHS events or on previous webinars with us. The summer study committee period is an opportunity for us to really impact some discussion about some various issues. And a lot of times during a legislative session, when there's an issue that might be too much to tackle in that particular session, or the legislators are looking for some more information, they will assign it to a summer study committee and go through an education process and potentially recommend legislation for the following year. So these next two slides, you can see there were a number of topics that were assigned to summer study this year, including some teacher retention and residency program issues. Let's see, supporting individuals in the criminal justice system. Let's see. We want to definitely keep our eye on uniform property tax assessment for nonprofits. So this has been an issue, a small issue for a while now, about how the state and localities are able to tax nonprofit entities with a lot of the large hospital chains and some other nonprofits having a lot of property and a lot of assets. There's some questions about how to do some different tax assessments on those individuals, and obviously since we serve nonprofit organizations and are nonprofit organizations mostly ourselves, something that's high on our radar. Sorry, go ahead.
One study committee topic that's not on this list, it's in Senate Bill 355 dealing with child abuse prevention. There is a study committee recommendation that I'm pretty excited about, looking at teacher professional development and how we improve and make more effective and efficient the training for teachers on various issues, including child abuse and suicide prevention and bullying prevention and gang prevention. So we're really hoping that that does get added as a study committee, because that's an opportunity to really revise all of the training and make it even better and more cost-effective for schools.
A couple of other big ones that we'll keep our eye on: rural broadband service, how to reach those folks in our rural communities. Voluntary paid family leave. This is obviously something that's supported by ICHS. The conversation never goes very far when legislation is introduced, but this year there was a bill introduced and passed almost unanimously, surprisingly, to look into voluntary paid family leave programs for businesses in Indiana. So we will definitely be keeping our eye on that particular issue.
And feel free to keep typing your questions in. We're getting a little close on time, so I'm just going to breeze through some of this quick. Nonprofit Advocacy 101. ICHS is always happy to have organizations who are members or aren't members get involved with us through advocacy, and we're happy to have more voices at the table to talk about policies that would benefit their clients and the services that they're providing. So if you're interested in getting started, feel free to reach out to us, and we can help you kind of develop a path that would work best for you and your organization. We always say that it's best when you have volunteers and board members helping to share that message on behalf of your clients and services. But there's different ways that you can get involved, including going to the State House, writing editorials and guest columns when a bill is coming up that may help or hurt some of your clients. You can work with your board, volunteers, and staff to do some relationship mapping to see how you might have certain connections with legislators already in your organization. And then we always encourage organizations to host a tour or have a legislator come visit, especially if you're hosting, for example, a VITA site, have them come and learn more about how you're helping to do those tax services, and then you can link that to tax policies that you're advocating for is one example. There's different State House days during session. Typically, these are ones that were held this last year, so you can keep your eyes peeled during that, eyes out for that calendar during session. And ICHS, IEW, and the Children's Coalition have different resources that you can view online to keep you informed. So yeah, we're always happy to help. Feel free to reach out. And I don't see any other questions in the chat box. We'll pause for just a moment. All right, we'll go ahead and stop the recording. We do have one question that we want to get to, if you don't mind staying on the line, but thank you for viewing this webinar, and we will now stop the recorded part.